This is Emily Walker, MedPage Today, reporting from Chicago from the American Medical Association's House of Delegates meeting. The House of Delegates just voted to endorse the individual mandate concept. The individual mandate is a provision in the healthcare reform law that requires everyone to have health insurance.
The American Medical Association today at its annual meeting here in Chicago voted to continue its policy of supporting individual responsibility for health insurance with assistance for those who cannot afford it. The AMA reviewed alternatives and concluded that any approach to covering the uninsured that is in line with AMA policy cannot be fully successful in covering the uninsured without individual responsibility for health insurance.
Although the AMA uses the term individual responsibility, it's referring to an individual mandate, a requirement that individuals have health insurance that is enforceable through the U.S. tax code, just like the controversial individual mandate that is part of the Affordable Care Act. And the issue is extremely controversial among doctors in the AMA.
This past year, as I have traveled around the country, I have had physicians come up to me and express approval for the stands the AMA has taken, and I have had physicians come up and express disapproval and on the stands that the AMA has taken, and I think you see that reflected in the members of the House.
I spoke with two doctors on opposite sides of the issue. First, Dr. David McCaleb, a neurosurgeon from St. Petersburg, Florida.
Well, I'm disappointed that our AMA has decided that it's not appropriate for Americans to choose whether they buy their own health insurance that they desire. And I think this sends a message to Americans and American doctors. If they want to stop the individual mandate, they're going to have to work hard and contact Congress. They're going to have to change Congress so that we can rescind this unconstitutional law.
Dr. Willie Underwood, a urologist from Buffalo, New York, held the opposite view.
I think it was very important for us to adopt an individual mandate. We have to assure that we have buy-in from everyone and that we have close to 100% health care coverage for all. Without the individual mandate, we have no impetus to even move in that direction so we can get 100% coverage, period.
From Chicago, this is Emily Walker, MedPage Today.